Good evening, everybody. I think it's time to get started this evening. So we'll make a start. My name's Susan Cedarblad. I'm the Workforce Development Manager at Brisbane South PHN. And thank you for joining us this evening for the Influenza Vaccination Program 2023 webinar. Firstly, I'd like to acknowledge the traditional custodians of the land on which we live and work and of the many different nations across the wider Brisbane South region. We pay our respects to the elders past, present and emerging as the holders of the memories, the traditions, the culture and the spiritual well-being of the Aboriginal and Torres Strait Islander peoples across the nation. We acknowledge any sorry business that may be affecting the communities as a whole. In the spirit of reconciliation, partnership and mutual respect, we will continue to work together with Aboriginal and Torres Strait Islander peoples to shape a health system which responds to the needs and aspirations of the community. Before we start, I'll just go through a few things. We've got everyone on mute this evening and your cameras are also turned off. So for questions, please put your questions in the Q&A box, in the chat box, and we'll answer all your questions at the end of tonight's presentation. We are recording the webinar this evening so that anyone who isn't able to attend will be able to access it over the next few weeks, months, in their own time via our website. So now I'll introduce our speakers for this evening. We've got the Metro South Public Health Unit team members presenting the session tonight. I've got Dr. Anu, the unit's medical lead and public health physician, who's providing a clinical update on influenza trends and other viruses. Then we've got Chris Olotta, who's a clinical nurse with the Public Health Unit, and she is going to give an overview of the 2023 National Influenza Immunisation Program. So I will now hand over to Dr. Anu, and we'll start the presentation for this evening. Thanks.
Thank you, Susan, for that introduction. Good evening, everyone, and I'm very pleased to be here and the opportunity to present. I remember those years when we used to just present on flu, and we now have a whole gamut of viruses, as we all know. So my topic today is going to be on winter viruses and vaccines and what to expect, a public health overview. And I will have my colleague Chris presenting on the flu vaccine update for 2023. Okay, so I think the topics I would like to cover today would be influenza, COVID-19. I think no talk goes without COVID-19, and respiratory syncytial virus. So 2022, after a gap of 2 years where we were fully immersed in COVID, we saw the return of influenza, and it did come back with a vengeance. So this is a slide showing the data. When I talk about NNDSS, that's the National Surveillance System. And we have lab confirmed influenza in Australia for the last 5 years here. What I'd like you to focus on is the red line, which is the 2022 data for influenza for the whole of Australia. And you can see that the height of the curve there is much higher than even previous years. Those who remember pre-COVID years, 2017 and 2019 were really bad years, but we had almost the same number of cases last year, believe it or not, for flu too, though it got a bit lost with COVID coming in with the borders opening. And this is a similar one for Queensland, so we mimicked exactly what we saw in the rest of Australia with the dark blue line there showing showing flu in 2022. And very similar picture for Metro South, which is south of the river, where we are all based at. And the green graph there shows COVID, influenza. So used to seeing COVID, I think, influenza that you can see. The difference between the other lines and the green line there, and as well as the previous graphs, you've seen that we did have a very early season of influenza. So you can see that we started getting our cases going up in around April, and we peaked in June, and then the cases started coming down by about August, which is quite early for flu, as you can see from the other graphs for the other years there. If you focus on the red line at the bottom, we can see that there is already a increase in the flu cases, and I'll show more of that in a minute. So this is what flu is looking like for Metro South, and this is up-to-date data, up-to-date up until this weekend, actually, the 2nd of April, you can see there. And you can see the trend is the cases are climbing up steadily, which is what we would expect, and that's why we are here to emphasize that we need to get prepared for this winter. So the last graph there may be not very accurate because we're still getting data coming through. On the lower table there, you can see what we are seeing in terms of A and B type influenza. So it's majority we're seeing A, and what we're seeing as well is the H1N1. This is slightly in contrast to what the Northern Hemisphere, so USA, Canada, Europe, saw more of a H3N2 during their winter season, but this could change as well, so we monitor the trends carefully. This is a very busy graph, but this is to show you about what is happening with flu by age and sex. Mostly men and women are the same, but when you look at the age group, I want you to focus on the circle that is there on the left side of the graph. So that is a calculation of what we call the age-specific rate. So when you look at the rates per se, you can see that there are more people represented in the middle of the graph that you're seeing. But when you calculate the age-specific rate, we are seeing about 162 per 100,000 people in the 0 to 4 year age group being affected by flu already. And in the last 4 weeks, that number is half of what we had seen this year. So the flu numbers are climbing up very rapidly. And what I want to emphasize is that children are particularly affected early in the piece. It's something we have to wait and see how it's going to go, and cannot emphasize more about how important in GP land to get our children vaccinated, and particularly the under 5s are offered a free vaccine by the government, and so it is our utmost duty to make sure they are vaccinated. Certainly, there is evidence to say that 65% of the people in a recent study that was done by University of Technology, Sydney, 65% of the people actually come for advice to their GPs and be it the doctor or the nursing staff there. So it's important to make sure that they are all recommended, highly recommended to get themselves vaccinated against flu. So this is some data on influenza deaths in Australia, and as you can see there, the notifications for 2022, 225,000 plus cases is almost similar to what we had, like I mentioned before, in previous years, bad years of 2017 and 2019. But the good thing we saw last year was that the case fatality rate or the number of deaths was relatively lower compared to those previous years. So this is to put a plug-in for what's the national dashboard. So you have a link there that you can use, and this national dashboard was actually unavailable for last 2 years over COVID, but now it's back and it's even more better, and it's interactive, so you can look at data yourself as to what's happening with flu and other notifiable conditions across the country. So for those who've been in the field for a long time, you would have heard about the H1, the H3s, and the 2B varieties of influenza, the Victoria and the Yamagata. But what this highlights is that we have seen over COVID a disappearance of the Yamagata strain. So we have in the Northern Hemisphere as well, there has been literally no Yamagata happening at all. So this is to look at what happened in the Northern Hemisphere. So a lot of the times we learn from what happened there to set when we want to give the flu vaccine as well. The season of flu normally in Australia peaks around kind of August, and we have the season between July and September. But like last year, we had an early season. Both USA and Canada here have shown that they've had a very early season of influenza. You can see the red triangles in the top left graph there, which peaked around the weeks 48 to 52, which you can see was end of 2022, which is the early in their winter season, really. And a similar picture here for Canada as well, where they peaked around the 47, 48 weeks of the year, which is around December in 2022. So they both have definitely had an early season. What's happened in Europe? So when we look at Europe, again, we see that if you look at the x-axis there, they peaked around week 50, which is towards the end of last year. But again, while the cases came down, they again had some more increase in flu cases over February as well. So it's very difficult to predict what a season we're going to have, but the recommendation is to get your vaccines into arms as soon as possible, because we can expect an early flu season based on what we are seeing already, as well as what the evidence has shown us from the Northern Hemisphere. This is just to put a plug on that it's just not COVID flu we are seeing. In 2022, we've also had other viruses pop up. This is data from New South Wales, but if you just focus on the light blue line there, which is the data for 2022, that's why it says 1st of January 2022 there. That blue line you can see has been kind of the highest compared to all other years for a lot of viruses. So the adenovirus, the respiratory syncytial virus, the human metapneumovirus, they've all increased in 2022. Whether we are testing more is another aspect to it, but certainly there has been a galore of viruses that we've had in 2022, and we can expect the same this year. Coming to vaccines now, and Chris, my colleague, is going to talk a bit more about that in detail, but what we have as usual is the H1, H3 and 2 of the B lineages in the vaccine. The adjuvanted quadrivalent vaccine is the one that is funded by Queensland Health for the over 65-year-olds. There is also a high-dose quadrivalent vaccine that is available in the private market for the elderly. There's also a cell-based influenza vaccine that's become available since last year, 2022, for from about children greater than 2 years of age, but that's only in the private market. And Novavax and Moderna are actually trialing a combined COVID and flu vaccine. However, we're told that it's not going to be available for this year, but if that comes into play, I think it will make life a lot easier. So what's been the vaccine effectiveness? So studies from the US have shown, so as you know, the composition is almost the same bar one of the H1 strains for our vaccine compared to what the Northern Hemisphere used. So we're looking at the vaccine effectiveness studies, and certainly there has been a much higher vaccine effectiveness that as these flu vaccines have shown last year. compared to previous years, and so ranging from about 54 and to 71% in community studies. So a bit more information on what happened last year with the flu vaccine, and which we wouldn't like to repeat. There were about 16.8 million doses to cover 66% of our population available in 2022. However, we only had about 43.4% of our eligible population vaccinated. So, and only children, 1/3 of the children under the age of 5 had at least one dose. So the rollout definitely needs to be a lot better, particularly with the climbing cases, particularly in children. And vaccine rollout also happened slowly last year, and there were multiple factors influencing that. COVID was at its peak in early 2022, but a lot of people were actually vaccinated after the peak. And we also had another one for the first time. 6 states in Australia were offering the flu vaccine for free. So I'm going to now focus on COVID, because I think that's the topical issue, and the COVID vaccine as well will be covered in my talk. This is the latest data on what Queensland's COVID numbers are looking like. So it should read PCR plus RAT there at the top, as we all know. The numbers have stabilized, but I think there could be a variety of reasons there, because people are not resorting to PCR or maybe even RAT. And even if the RAT is done, it has to be self-reported into the portal. So it is important to advocate for your patients as well, to ensure that they get the RAT results into the portal, which is easily accessible on the Queensland Health website. While we look at the COVID rates in Queensland, the COVID positivity rate is a very good indicator of how things are flowing. As you can see here, the peak that we had in December towards the end there was almost as bad as the previous ones, though the case numbers were not that high. The positivity rate gives us an indication of how severe a wave is. Certainly, we are predicting that there is going to be another wave, which has been smoking for quite some time, and the positivity rate is lingering around the 6 to 8% mark at this stage. But the good news here is that while we saw COVID weekly deaths, the blue graph is the 2022, as we all know, particularly at the start of 2022, and towards the third wave as well, we had a lot of deaths. We certainly have managed to conquer that, and the green is the death rate for 2023. So what about the winter dose? Now, I think there's been a bit of silence about even in the community about people talking about the COVID vaccine, but it is very important from a primary care perspective to promote a COVID vaccine, particularly the winter booster dose. And I'm here to talk a little bit about the effectiveness of this vaccine. So ATAGI recommends that there is a winter vaccine booster dose given to all our adults over the age of 65, and also those aged 18 to 64 years who do have medical comorbidities. Certainly, it is a consideration for other adults who don't have risk factors under the age of 65, as well as in children 5 to 17 who do have medical comorbidities. So when did these vaccines get approved? So on the 8th of February was when the Pfizer bivalent vaccine, which has 2 types of antigens. So it has the antigens for the ancestral strain as well, the Wuhan strain, as we all remember it, and as well as it has antigens for the BA.4/5, which particularly the 5 had been the predominant circulating COVID virus over the latter half of last year. And on the 20th of February, we had the vaccine rollout commenced. And on the 28th of February, we had a Moderna bivalent vaccine also approved. The reason I'm talking about these timelines is because although these vaccines have only been approved in Australia very recently, they have been used in the USA since the 31st of August last year. So when you look at what is the benefit of this vaccine, what is the safety profile of this vaccine, we do have a lot of evidence from the Northern Hemisphere, particularly they've gone through a winter season as well. And so they've approved this vaccine, and USA was the first to approve and start using this vaccine from the 31st of August. Subsequently, there are lots of countries like Canada and most of Europe had used this as well. So we do have a lot of evidence on what the effectiveness of this bivalent vaccine is and what the safety profile is. So I'm going to talk you through some of the studies and real-world immunogenicity data. So when you talk about immunogenicity, it is about what the antibody response had been in people. So this is a study that compared monovalent booster as well as the bivalent booster. And what I've got there marked in the blue circles, you can see that not only the BA5 antibodies increased, but the bivalent vaccine has also had a very good response, or much higher antibody response to the ancestral Wuhan strain as well, and which is very important from the immunogenicity perspective. So moving forward to build people's immunity. Another concern, obviously, is about the new variants of COVID that you will all be hearing about, and the BA 1.1, XBB, BA 2.75, and so on. And the real-world immunogenicity data on this shows that if you focus on the red box there, the bivalent booster certainly has had shown to be effective in producing more antibodies against all these other newer variants as well. So this is looking a bit more promising, particularly in the wake of the changing profile of COVID strains. So this is, now we're moving from immunogenicity studies and moving on to effectiveness data, which is talking about when people have had the vaccine, what's the rate of hospitalizations, deaths, and so on. So certainly this is a big study from Israel that came out end of last year. And you had, they were followed up, people were followed up after having the bivalent 4-5, which is the one that's been approved in Australia now in February. And particularly in adults greater than 65 years of age, the vaccine effectiveness in relating to hospitalizations was 81%, and relating to COVID deaths and preventing COVID deaths was 86%. And there are more effectiveness data from the USA. Again, these studies have shown have been looking at hospitalizations among adults, as well as the second one, the Suri et al. In 2022, which came towards the end of these, were all published in December last year. And they have shown that preventing COVID-19 hospitalization, particularly among adults greater than 65 years. So there is strong evidence to say that the bivalent booster that is now available as the winter COVID booster dose has provided strong protection against COVID-associated hospitalizations in our elderly. So what about the safety? I know there have always been concerns about myocarditis and pericarditis, but that certainly has been comparable or even lower compared to our previous monovalent vaccine. So in the USA, again, they've had 22.6 million doses administered from the 31st of August when it was approved to October 23rd. And there were only 5 cases of myocarditis, 4 cases of pericarditis reported in this and this is through a adverse events reporting system that they had, and there were no new safety concerns reported here, and this is for all age groups. Whereas there has been some concern, you might have seen in the media as well, of people over 65 who had the bivalent vaccine having ischemic stroke in the 21 days following vaccination. Now, this was looked at in greater detail. This came out towards the end of last year, but when they looked at 21.3 million people who have had, and this is over the age of 65, who've had the bivalent vaccine, and they looked at a number of databases for safety signals, they could not find the same concern of ischemic stroke. However, Australia will take this seriously, and this will be closely monitored as this winter dose is getting rolled out. I want to touch in my last 5 minutes about the respiratory syncytial virus, or RSV, which is, you would have heard, this is becoming more prevalent at the moment. And as I showed in a previous graph in New South Wales, we have seen a lot of RSV in 2022. So RSV is the most common cause of acute lower respiratory infection, particularly in children. And globally, it is responsible for about 3.6 million hospital admissions yearly. So that's quite a significant amount of morbidity. And when it comes to mortality, 2% of deaths in children aged under the age of 5 years, and 3.6% of deaths in children under 6 months of age have been attributable to RSV. However, this has been mostly in low and middle income countries, but we do see the burden of presentations to primary care as well as to our hospitals in Australia. The thing that is very concerning about RSV is that there's no lifelong immunity. In fact, reinfection keeps occurring throughout life, and that's one of the reasons why there has been no effective vaccine as yet. So it is quite a community disease, particularly most of the children would be infected by the age of 2 or 3. And you can see that a third of them definitely need to present in the community to primary care, and 2% get hospitalized. So it's a leading cause of ED presentations in infants. And as I said, it is a big burden of hospitalization when it comes to cost as well as the morbidity associated with it. So what is it looking like for us here? And this is a graph that is showing the RSV curve, and you can see the yellow bit is the rest of Queensland, and Metro South is represented in the orange at the bottom there. RSV data became available to public health only since July 21, when it became a notifiable condition. So we're looking closely at the RSV data now. And since it started becoming available, we have seen that in 2022, obviously in 2021, because of the lockdowns, we did not have too many viruses. But in 2022, we've had a significant increase. And again, this was coinciding with the flu peak as well in 2022. And as we see towards the end of the graph there, we are seeing RSV coming back up again, which is what it is expected to do. But the age group for RSV is very different. It is particularly, like I said, affects the infants and children and under the age of 5. So you can see here that while they are the 1 to 4 year age group has been the most affected, when it comes to the age specific rate, which is the dotted line in red, you can see that children under the age of 1 are really vulnerable to this virus. So it's important to keep that in mind in primary care. So clearly it has very seasonal epidemics as well, and it precedes the flu season usually, but it's interesting that it coincided with the flu season last year because we've had an early flu season as well. And usually it lasts for about 4.6 months on average. And this information is really important when we have to plan how we're going to do health service delivery, be it primary care, secondary, tertiary care, and also to plan prophylaxis and immunization, which is in the pipeline more. Certainly, while that's the norm, COVID has changed some of the dynamics of the virus as well. And a single major lockdown in New South Wales in 2020, we saw that there has been a suppression of the RSV season. So in 2020, you would know that there has been lockdowns on and off, and we did see the red line there, which is very different to the rest of the graph there. That's the red line is the 2020 RSV line, and you can see that it was more towards the end of the year, which is summer in Australia. So the seasonality of RSV has been changing a bit here, and so it'd be interesting to see how it progresses. And RSV infections have also changing in their epidemiology and affecting a slightly older age group as well. So 2 to 4 year olds, it increased by 84%. Certainly, the vaccines are the way to go. Again, this is still in development, and there are 2 types of vaccines that are being looked at for the proteins that are, again, on the surface of the virus. So vaccine and MAB, which is the monoclonal antibody for RSV prevention, is certainly within reach. It is expected that the monoclonal antibody for preventing RSV may even be available towards the end of this year or early next year. And there are vaccine trials that are happening at the moment, and particularly the maternal vaccines are the ones that are being looked at to come out first, given that this is a burden in babies under the age of 6 months. So far, the trials have shown that the vaccine is quite safe and immunogenic. So we've got 3 groups that we're looking at for this pediatric, maternal, as well as elderly. But RSV awareness is certainly needed, and that's why I wanted to include RSV in my talk here today as well. Of when they interviewed close to 500 pregnant women attending an antenatal clinic, 83% of them had never even heard about RSV. So it's important to raise awareness of RSV. Okay, that's all I had for you. I'm going to now hand over to Chris, and please put any questions you may have in the chat, and we will take them at the end of Chris's presentation. Thank you.
So good evening, my name's Chris Alotta. I'm a clinical nurse at the Public Health Unit. We're just going to talk about the Influenza Vaccination Program for 2023. So the key areas we're going to talk about briefly will be infection control and general practice. Then we're going to look at what's funded under the NIP program, looking at the interaction with COVID, what the considerations around COVID-19. We're going to talk about vaccine safety and just some general questions that tend to come through Public Health Unit. So as you're aware, there's 2 really good documents talking about infection control resources for general practice. So one's from the RACGP and the other one's from the National Health and Medical Research Council. So I just thought I'd put those links up so that if you haven't seen them or you're not familiar with them or you'd like to re-access them, they're the links. So that'll be in the presentation recording, so you can look at those later. With any sort of infection control, we've just got our standard precautions. And the reason I'm repeating this is because we're going into, like Anu has alluded, there's a lot of respiratory illnesses coming or are circulating in the community. And some basic hand hygiene, PPE and cleaning will help prevent some of that infection. In addition to that, once we have got the flu, the influenza and COVID and stuff working, as you know, for the last 3 years, we've actually increased our precautions to either droplet precautions or surgical masks, at least when patients come into the GP practice. But we also want to make you aware to, put a little bit of emphasis on screening them and segregating the unwell people away from the well people, especially with things like, international travel coming as well, because, it's effective against a lot of infectious diseases. With infection control in general practice, it's important to care for your staff as well. So I've just thrown this slide up because I guess when we're really pushed and hammered for staffing, it's really easy to come back to work while you're still unwell. And although you may think the masks are effective, they need to be changed frequently, and there's always that risk to infect other people. So we recommend that 5 days post onset of respiratory symptoms that you remain away from work. If you're dealing with high risk groups, the preference is always for 7 days exclusion. The other option is 24 hours post resolution of symptoms, or if you're on antiviral medication, it's 72 hours post that commencement. So there's a few different variances there. So if you're not sure, check with your doctor and just have a look at the current guidelines and talk to your practice manager and your GPs. The important thing, I guess, with any of these talks is to actually vaccinate yourself as well, to look after your own health and well-being. So it's a good reminder for us to consider vaccines as well coming into the flu season. Talking about the National Immunisation Program for 2023, as the news already alluded, there is a low uptake in the following groups historically in the last few years. So we will really want to remind ourselves that any child presenting under the age of 5, it's a good opportunity to talk to the parents about flu vaccines. First Nations people and pregnant women. So pregnant women, if they've had a vaccine immediately before falling pregnant, it is recommended they receive another one during that pregnancy to protect the unborn child. There's also an identified resurgence of multiple vaccine preventable diseases with the reopening of the international borders. So it's useful just to remember not only influenza, but also the COVID-19 bivariant that we're talking about, bivalent, and also measles. We've had some circulating measles recently. So it's a good opportunity to remind yourself that Queensland Health does fund 2 measles vaccines as well for anyone who lacks the documented evidence. And that's for adults as well. So have that conversation at the same time if you can, please. Eligibility for the vaccines, the influenza vaccines, as you know, they haven't changed from last year. So any child aged 6 months to less than 5 years is automatically eligible to receive the free vaccines through Queensland Health. People aged 65 years and over are funded for vaccines, and also your high risk groups. So that's your pregnant women at any stage of their pregnancy. All Aboriginal and Torres Strait Islander people aged 6 months and over are eligible for free vaccines, and any child that's aged greater than 6 months with specified medical conditions. Now, most of you should have received your pack already from the government in regards to your National Immunisation Program. This is I've just cut this table out of one of the documents that you have received. It's a good little reminder of what's available. So as you can see here, you have got the age groups. So it's very important to make sure that the child that you're vaccinating or the adult you're vaccinating is in the right age appropriate vaccine. We've already had a couple of phone calls where children have received Fluad Quad, and if you look at the table, you can see that it's not funded for anyone under 65 years of age. So just be very, very careful. There's also an age range identified on every syringe, so there shouldn't really be no reason for vaccine error. Of course, if you do have that vaccine error occur due to a mishap, always speak with the GP, advise the parents or advise the person receiving the vaccine, and give us a ring if you've got any concerns. So I won't go through this in a lot of detail, but basically just be aware that you've got your 6 months to 5 years group, your 5 years to 65 vaccines, and then you've got your special ones for 65, your adjuvanted vaccines. Now, as Anu's already mentioned, there is a cell-based vaccine out on the market, but it's not funded at the moment through Queensland Health, but the information in that's in your pack. And all vaccines, all the egg-based vaccines can be given to people with egg allergies. So basically, they're all quadrivalent vaccines, which is what Anu's already alluded to. Always please enter onto air as soon as you've administered the vaccine. And remember, people with egg allergies can be safely vaccinated with an egg-based influenza vaccine. We're sort of hammering the children a little bit tonight, but they are a substantial reason for transmission in the community. So it's always good to just, if a child's being vaccinated for the first time during the flu season and is vaccine naive for influenza, they're entitled to 2 vaccines 6 months apart in their first year of vaccinations. Then every other year that they get 1 vaccine after that. So just, remember that. With your 6 months to less than 5 year vaccine funded by Queensland Health, you've got 2 options. You've got the Vaxigrid Tetra or the Fluarix Tetra. And we've already talked about the 2 doses, 1 month apart in the first year. If a child has presented to the clinic and has had 1 dose, but doesn't re-present for the second dose in that same year, the following year they just get the 1 dose after that. So all subsequent years give 1 dose. Precaution with pneumococcal vaccines. So if you're vaccinating a child for pneumococcal, there is a slight increase of temperatures or fevers after the administration. So just make sure that the parents are well aware of that and look for that. Also remember, there's no registered vaccines for children under 6 months. So none of the vaccines we're talking about tonight are registered for children under 6 months. That's why the pregnancy vaccine is very important. For children aged 5 to 64, children aged 5 up to adults at 64 years of age, you've got the choice of 3 different vaccines. The main category you'll be vaccinating for in this category is all Aboriginal and Torres Strait Islander people over the age of 5. Any individual with medical conditions predisposing them to severe influenza. And the definition of medical conditions is outlined in the packs that you should have received, or you can look it up online or through the Australian Immunisation Handbook. All pregnant women at any stage of pregnancy are entitled to a free flu vaccine. If it's given very early on, say the first trimester, it's worth considering whether you want to repeat that dose before delivery to give the child the maximum immunity post-birth. And just remember, give 2 doses 1 month apart for children aged less than 9 if this is their first year receiving influenza. Now, this is the medically at-risk groups eligible for funded flu vaccines, similar to what we use for other vaccines. And I won't go through it today, but it's on the ATAGI advice on seasonal flu vaccines 2023. It's also outlined in the Australian Immunisation Handbook. So just look up under diseases, influenza, and it will give you the medical risk categories. For pregnancy, we recommend a vaccine every pregnancy for flu. So if for whatever reason the mother received the flu at the end of 2022 and happens to fall pregnant this year, then she is entitled to a second vaccine. If the vaccine's been received before becoming pregnant, please revaccinate during pregnancy to give the child maximum protection in the first 6 months after birth. And the flu vaccine can be safely given at the same time as pertussis vaccine and or COVID vaccine. And just a gentle reminder, for pregnant women, we offer usually 1 dose of whooping cough, ideally given between 20 and 32 weeks of pregnancy to give the child maximum protection postpartum. As Anu mentioned before, this is the preferred vaccine for 65s and over. It gives higher response. It's an adjuvanted vaccine. The only precaution we would say is because there's a lack of evidence with co-administration of 2 adjuvanted vaccines, that is your Fluad Quad and your Shingrix. The current recommendations is to separate their administration. However, if you do, for whatever reason, need to give them both on the same day, they can be administered with precautions. So just give good advice to the family, to the person receiving the vaccine. Fluad Quad can also be given with COVID vaccine. These are just some general administration considerations from a a vaccinator's point of view or vaccinator's standpoint. Recording on air is mandatory. That's part of the requirement of actually providing vaccines. As Anu's already alluded, the flu season can be unpredictable, so the timing of the vaccination is everything. And children receiving vaccine for the first time should be vaccinated as early as possible in the flu season so that they can have their second dose before the flu season starts. And vaccination later in the same season is not routinely recommended unless for pregnancy or travel. And currently we're only funding one vaccine except for the children that are receiving their first vaccine. So if you are repeating the vaccine in pregnancy, it will need to be privately funded. I just thought I'd do a quick screenshot of what the immunisation handbook looks like. There has been questions in the past about vaccine components. So if you do need to look up a vaccine component, you just go to the section in the Australian Immunisation Handbook under vaccines. Then you select whatever the vaccine type is that you're looking for. And when you open up that section, it'll tell you the contraindications, the components and everything else about the vaccine. So that's a good one if you're worried about, egg-based components or latex or anything that you want to know about the vaccine components. Some cultural beliefs prevent bovine and that sort of thing. So that's in the Australian Immunisation Handbook. So I just thought I'd quickly, we've had a few phone calls recently from practices concerned about when their vaccine rollout's going to be. So I just thought I'd put these main dates up. So basically everyone should have received a letter from QIP on the 2nd of March. Last week, QIP started the deliveries to all practices. It's expected it will be a 2 to 3 week rollout, but they are aiming to have all deliveries at the practices by the 6th of April, all things considered. If for whatever reason it's been a delayed delivery, it could be that you've had a recent cold chain breach or there's just been issues with transport or courier services, you are able to start putting in your own orders after the 11th of April. I just thought I'd throw this form in. This is the form where when you do want to order additional NIP-funded vaccines, this is the form you need to look for, and that's just off the website. So just Google Queensland, the QIP NIP-funded influenza vaccine order form. Now, most of your stock from last year should have expired, so you shouldn't have any expired stock in your fridge, but it's probably timely to just go through your stock and just discard whatever's expired. Do not share your vaccines or order more than you can safely store. So, just with your cold chain management, your vaccine management protocols, just make sure that you have adequate eskies, ice bricks and bubble wrap and thermometers to manage your cold chain breach if you do need to transfer those vaccines into an esky. Remember, the only contraindication to receiving a flu vaccine is anaphylaxis. So if you have an egg allergy, that is not a reason not to provide a flu vaccine. Also, we've had in the past questions about latex, if there's latex in any vaccines, but all the influenza vaccines in 2023 are latex free. And remember to report any adverse events via the adverse event following immunisation reporting form. Just to conclude, I've just got this, I know there's a lot of information on this page, but this is a lot of resources that we use when you make a phone call to us. So obviously there's quite a clear algorithm that we follow when you make a phone call. So we always look up PROTA first to make sure that what vaccines you're talking about are on air or you're about to go onto air. So we always check the immunisation record of an individual. We also open the Australian Immunisation Handbook at the time of the phone call and look up all the questions that you may be asking us. We'll also refer to any recent publications in 2023. So it's worthwhile if you have got the opportunity to become familiar with these resources, because you'll probably find a lot of those answers in the resources before you ring us. The ATAGI and the NCIRS statements are a little bit more complex, but they actually form the background of the Australian Immunisation Handbook. So that's a lot of the decision making and algorithms there. So we also look at that as well. If for whatever reason you're struggling with using the online version or accessing any of those resources, we are there to help you. So I've just left our phone number there, 3156 4000. Sometimes it does take us a significant amount of time to get back to you, depending on what's happening in the public health space. So ideally, if you have a question and you have a patient in the clinic, it's probably best for them to be advised that you'll follow it up with a phone call to them, because most of our wait times can be up to 1 or 2 hours. So it's worth considering. So that concludes my presentation. Just on behalf of the Metro South Public Health team, a lot of this data that Anu presented today was put together by two of our incredible epidemiologists, Gail Pollard and Bonnie McFarlane. So we just wanted to acknowledge their hard work in putting this slideshow together. Thank you.